Hello, everyone. My name is Coletta Irby. This is Psychology 620 Learning and Cognition with Professor Karen Hathaway. Today's date is July 9th, 2022, and today I will be teaching you about reciprocal determinism, informational processing, and learning of cognition, a therapist study. So, a little bit about me. I'm 34 years old. I have my bachelor's degree in criminal justice, and I'm currently working on my master's degree in psychology through the University of Arizona Global Campus. I started school back in 2018 and will actually complete my master's degree in May of 2023. I work at a behavioral problematic residential home for 2 years now as a mental health provider, where I see clients in a session setting to teach them coping skills that target towards their individual treatment plan. I also help prevent crises that they may experience due to trauma they had in their younger lives. I'm currently starting my internship as a therapist through my company, and I plan to become a child's therapist post-graduation. I want to continue my education, eventually get my PhD in psychology. So it's very important while dealing with clients that with behavioral problematic that you individualize them. It's important for each client to have their own treatment plan and be treated as an individual in order to boost a higher success rate. While that is happening and we have that plan, the client will be more likely to commit to their treatment that best works with them. There are many benefits as far as individualizing our clients. Those benefits include emotional, mental, and the behavioral issues being resolved. By learning their past trauma, you will effectively be able to help in planning of their treatment. Develop a healthier and more functional personal habits, and it will help the client realize that their behavior is unwanted. With the use of positive reinforcement, when good behavior is exhibited, you will then change the bad behavior. There are many theories that we will touch on to explain behaviors. The first one is reciprocal determinism, which was first studied by Albert Bandurros with the Bobo doll experiment. We have our informational process, which is Pygott's theory on how limited capacity of the working memory or short-term memory links to age and behavior. And then cognitivism, which is the assist in learning new information to our previous knowledge. Reciprocal determinism is Albert Bandurros' Bobo doll experiment on aggression. Albert learned that a person's behavior was influenced by personal factors as well as their social environment. So through sets of consequences, according to George Miller, the three components are environment, personal factors, and then the display of your behaviors. Each component does play off each other. Albert's Bobo doll experiment proves that children's aggression is a learned cognitive behavior versus your biological. So the Bobo doll experiment aimed a study to prove that aggression was learned and not a biological behavior. During the experiment, 72 children ages 3 to 6 years of age participated in the study. There were two variables to determine the theory. There was a non-aggression child and an aggressive child. Each child was placed in a room where they either exhibited aggressive behavior towards a doll or just normal play with another adult. After playtime was over, the child was left in the room to see what they would do. The children who went through the aggressive trial expressed aggression towards the doll as they had seen the adult do, whereas the non-aggressive children played nicely with the doll or didn't even play with the doll at all and showed well-mannered behaviors. The theoretical perspective on reciprocal determinism. Albert hypothesized was proven to be right. The way that a child's behavior was expressed was influenced by three factors. So your personal factor, which was frustration, which then exhibited aggression as far as your behavior. Whereas if it was caring play, there was less aggressive to no aggression at all. The social environment, so seeing another person interact aggressively or not, then determined how the behavior of the child was. And then thirdly, our behavior. If the child was aggressive while left alone to play in your aggressive trial, whereas the children that played nicely went through the non-aggressive trial. Informational processing, a play on your cognitive mind. So informational processing aims to explain how information is encoded into our memory. Gene Pygatt's theory of informational processing suggests that cognitive limitations are based on certain developmental stage an individual has. So the age of the child links directly towards their limitations. We store new information just the way as a computer does. So we receive information, we store it, and then later retrieve the information when it is needed. Pengheffey states that text information is encoded while images and audio are being encoded and stored at the same time. This is also known as dual information processing. For our clients with learning disability, dual coding is impossible for them to do due to the blockage their disorder has on their memory. Learning how the individual learns by individualization on the client will help necessary processing, incidental processing, and maintenance of superficial characteristic by increasing memory recall processing. John Sweller says that the cognitive load theory also deals with the learning and problem-solving difficulty that is artificial and it can be manipulated by instructional design. Most of our clients have multiple learning disabilities, meaning that us as therapists have to design an easier way for the client to learn new information that can be stored in their memory. The easiest way to do this is to create a schema, acquisitions, and automations, which are primary mechanisms of learning, and it will increase the chances of their learning. Underdeveloped minds have a greater risk of developing anxiety, depression, attention disorders, as well as aggressive behaviors. So there's many ways that we can help the underdeveloped minds. In fact, there's 5 concrete steps into helping clients with underdeveloped minds and improve informational processing, according to Judy Willis. 1, we teach collaboration as a set skill. We encourage that our clients work together on their creativity. This will benefit connection into the real world as they're getting ready to discharge from the program. Build on evaluation and analysis. So this skill set will actually help our clients know how to research on accurate information, just thus helping them properly question new information that they might not know that could potentially be false. Teach tolerance and self-resilience. Have open discussions with those clients, which then will allow the student or client to be open-minded in a new, healthier experience. So, for example, taking them out on trips, maybe discussing new scenarios they could see themselves in the future. Number 4, help the clients learn better by using their strengths. One size does not fit all. Individualization will help the students use their strength to learn while increasing their self-realization, self-esteem, and self-image. Number 5, it's important to encourage learning beyond their therapy, providing opportunities for the student to execute their new skills. So, for an example, ask the client, what would you do in this scenario? Use active listening and try to not to criticize the response, while encouraging them with positive reinforcement or hurdle helping when they get stuck on a certain question. Cognitive theory is Gene Pygatt's theory, which they believe that would be learned in 4 stages: sensory motive stage, pre-operational stage, concrete operational stage, and formal operational stage. As clients progress in their learning, it is important that we have balance between assimilation and accommodation, according to Kendra Cherry. Qualitative change, such as several schemas, categorize the knowledge that will help interpret the new information. Our cognitive development will help us understand how the client's intellect will grow. SSNR, the number one deterrent for consequences of toxic stressors. So SSNR stands for safe, stable, nurturing relationships. It's important that we make the children feel safe. By making them feel safe, it'll lower escalation during a crisis state of mind. Stable relationships, it's important for stability of a child's relationship, and it is the most crucial factor in whether a child thrives developmentally and goes on to have success in their school, according to Myra Haskell. We need to provide a nurturing environment. It would make learning more enjoyable, reduce stress, create better opportunities for new information to be processed, stored, and recalled. And it's important to build healthy relationships because it will heighten motivation to learn the new information. Trauma-informed living environment, relationship base. Trauma itself, specifically developmental trauma, results in a failure of relational connection, and healing itself can build the restorative of relational connection. Healthy relationships are necessary to manage with stress, expand anxiety, and build resilience. Self-regulation is more of a product of the support that we need to offer our clients. Healthy therapeutic relationship is the most robust predictor of positive outcome long-term and one of the strongest predictors of treatment success. The healthier the relationship is with the child, the more likely they will be able to recover from their trauma and thrive. Relationships are the agents of change and the most powerful therapy in human love. So what do we do when we have challenging behavior, and what could they look like? So controversial wisdom. Kids do well if they want to. So being passive, permissive, and consistent parenting, youth will avoid things like learning. There's always intervention, trauma, uniformed rewards, punishment, ignoring, and punitive punishments. These will cause challenging behaviors. Collaborative problem solving, so kids do well if they can, and lagging their thinking skills use as a kind of learning disability. Then we have intervention, trauma reinforced. We're trying to change the behavior, build the skill through relational process. When challenging behavior occurs, there are 3 ways that we can respond to it. You have your regulators, your collaboration, and to harmonize. Now, depending upon the situation you find yourself in, would depend upon which of the 3 you would want to use. So, with your regulators, you have your power over. So, impose adulthood, focus on your adult concern, most popular in RTC setting and useful for neurotypical kids. Increase power difficulty, which can upset you further, and it's most appropriate when uses of immediate safety are at hand. Collaboration, you would solve the problem together, both adult and youth. Concerns are heard and considered. Balanced stress response and regulations. You have shared power, and you represent the ideal approach that adults use with youths. When you harmonize, you drop the issue for now and you strictly focus on your youth's concern. You're not bailing, but treatment plan. You decrease power differentiality, and it is the most appropriate if the issue will cause a crisis over a problem that the youth is not working on. This is a thought-out strategy. I would like to thank you for taking a time out of your busy day to learn the importance of how we perform our job and how it will return the success rates of our client who suffer from learning disabilities. If there are any questions at this time, I would love to hear and answer them to the best of my ability.